Hey girl, hey, this is Dr. Tasha, and I am back with a Monday medical moment. Now, before we get into this, because we're going to dig all up and through, make sure you stop this video, like it, share her, and make sure you're subscribed, because then things like this will pop up on your timeline or your algorithm, and you'll make sure never to miss a video, because we try to drop fire all the time here. We try to have all the vibes, okay? So today we're going to be talking about pelvic congestion syndrome, but I want y'all not to forget, did y'all get y'all tickets for the retreat yet? Yes, if you haven't gotten your tickets for the retreat, go to cleanandcute.shop, hit the shop tab, and they are right there. It is going to be a vibe. If you're also not following my girl Ariel Jenkins Jr. on Instagram, she's our MC. She's that girl. She's hilarious, okay? And so it's just going to be vibes. It's going to be a time. So I really want y'all to come. If you come, great. Otherwise, sorry. Hopefully we catch you next year. But it's going to be fire. Okay, so today I want to talk to y'all about pelvic congestion syndrome. And the reason I'm doing this, I saw somebody do a post about it. Not a post, she did a video just explaining what was happening with her. She was very tearful, she was very emotional, and it really tugged at my heartstrings, because being a gynecologist for over 23 years, I've seen it, I've worked with it, and it's a thing, but not as much of a thing as people who are trying to come up off of it make it to be. But it is a thing, right? It's a serious thing for people, more emotionally and physically too. And so let's not make light of the fact that, oh, it's a thing. But I also want to talk about like kind of how to deal with it. And because people are like, oh, we don't know why it happens. We know what it is. We don't know why it happens and don't really know how to fix it. We're going to help you with the symptoms, kind of, and good luck with that. And no. We're going to talk a little bit more about it than that. So yeah, we're not going to leave it at that, sis. And then to boot, I was really thinking about it, but I was like, I don't want to seem like, you know, I'm making a video about this person's situation. No, because then I got an ultrasound on my desk today. I went into the office today, got an ultrasound, and the crazy part is I don't really think this person had any symptoms when I did her ultrasound. When I did her pap smear, I felt like a sense of fullness when I did the pelvic exam, because if y'all doctors are not touching you, what are they doing? But I did a pelvic exam and I was like, why does it feel so full in here? It just felt full. I didn't feel a mass, it just felt full. And you kind of don't really understand what that means if you're not a gynecologist. But anyways, I sent her for a pelvic ultrasound, and lo and behold, what do we find? Pelvic congestive syndrome. So I'm always like, if it's happening to 1, it's happening to 100. If it's happening to 2, it's happening to 200. And I'm like, maybe it's starting to rear its ugly head again. And I'm going to tell you why, I think. But I'm like, maybe this thing is starting to rear its ugly head. Let's talk about it. Let's get some shine on it. Let's get some attention being paid to it, because there may be people out there who are actually suffering from it and don't know, think it's something else. It can be very difficult to find if you're not looking for it, especially as a gynecologist. But at the end of the day, you know, I hope at the end of this video, shedding some light will help people who already suffer from it and maybe give them more direction and more I don't even know how to say it, but just other alternatives to treatment and therapy. And then for those who may be suffering from it and didn't know they were suffering from it, maybe this is a aha, let me take this to my gynecologist, let me do some research on it, and go from there. Okay, so and again, for me, I think that treatment or therapy is based on where you are in your life, and not necessarily emotionally, but I mean age wise, reproductive wise. It's really kind of where you are. But let's talk about it. So when it comes to pelvic congestion syndrome, and it's called pelvic, and it's because it's in your pelvis, usually dealing with the veins in your ovaries, but it's pelvic congestion syndrome. Pelvic congestion syndrome, excuse me, y'all, it's the end of the day. And essentially, basically, the veins in the pelvis become engorged, and for very good reason. Generally, veins, what they do is they go from basically kind of your pelvis or from down below, and the veins carry the blood up to your heart, right? But when you have pelvic congestive syndrome, and the way that let me start over. The way that actually happens is it goes from your pelvis up to your heart, and we have valves, like little trap doors in our veins, and it comes up, and the trap door prevents it from going back down. And it pushes up to the heart. Well, when you have pelvic congestive syndrome, I keep saying congestive, pelvic congestion syndrome, what ends up happening is those valves are not working properly, and the blood pools or collects in the pelvis, and it basically dilates or engorges the veins. Because it can't push back up. And what happens is, imagine something being a dime size, and so you have a dime size stopper. Well, when the vessels dilate, now they're quarter size, so that dime size stopper, that ain't helping you none. So therefore the blood is pooling in the pelvis. It's not pushing up toward the heart, it's pooling in the pelvis. And a lot of times it can, the veins will twist. They just get so dilated and engorged. And then sometimes they are so dilated and engorged, and they will press on nerves, because it's usually a complex artery, vein, nerve. They literally travel like, that's the trifecta: artery, vein, nerve. So sometimes what will happen is the veins get so dilated, they compress on the nerve, and sometimes that's where the pain comes from. And sometimes, because we're not getting enough blood up, patients with pelvic congestion syndrome tend to have issues with dizziness. If they stand up too fast, it'll be like, whoa, head rush, I got dizzy. Sometimes they will just have dizziness because not enough blood, not enough blood is going back up to the heart, and the pressure is not high enough to kind of sustain, if that makes any sense. It is not life-threatening, although the symptoms are annoying as hell, problematic as hell. It is not life-threatening, but it is something that certainly impacts your life. And, you know, when we get swollen, twisted veins, they hurt. Outside of just compressing on the nerve, it hurts. Anything that's swollen and twisted and conjoined, she hurts. And so a lot of the symptoms that tend to go along with pelvic congestion syndrome are like pelvic heaviness. Like you feel this dull, achy, just heavy. It just feels like, feel like something just sitting there. Just like, why does it feel so heavy? Why I feel like something finna just come out my cooch parts. So it can feel like that. You can have pain during and after sex. Now, again, let me be clear. A lot of the symptoms with pelvic congestion syndrome feel like other stuff. So this is why it's not like, oh, bam, this is what you got. Why didn't anybody notice that? No, all of the symptoms can be symptoms that you feel with endometriosis, or symptoms that you feel with fibroids, or so it's not very clear cut. So let me just say that before we keep going. So pain with sex and after sex, worsening pain with prolonged sitting and standing. So you'll get pelvic pressure, pelvic discomfort, leg pain, leg discomfort if you're sitting or standing too long. And interestingly enough, if you lay down, that will actually relieve the pain. And imagine, so you have something, the pressure's like this, and then you lay down, so then the pressure levels out, and so you start to feel a little bit better. Sometimes people have low back pain. Again, that pelvic situation and that pressure, their abdominal bloating, pain. So they generally say it's not, so the pain with pelvic congestion syndrome is not because of your period, but you can have discomfort before your period, and you can even have painful periods, but it's not because of your period. Does that make sense? I hope that makes sense. The pain is also worse at the end of the day, obviously, because you've been sitting, you've been standing, you've been doing more things all day. So the pain is worse at the end of the day. And as far as the pain is concerned, when we talked about dull, achy pain, heaviness, it can also be sharp and intense, but that's less frequent. It's less likely that it's going to be sharp and intense. It's more going to be dull and heavy. Also, the pain is going to be more common on the left side. Now, it can be on the right as well, and it can be both sides too, but you're going to more commonly see it on the left side. Okay. Now, why does this happen? Why do some people have it and some people don't? We don't know. Why? What creates it? Honestly, We don't know. There are theories. The theory is pregnancy. Well, if you've never been pregnant, or you're not pregnant, then that's not really it. But why do we feel like it's in pregnancy? First of all, your blood volume doubles almost when you're pregnant. So oftentimes, yeah, you're gonna have dilated veins when you're pregnant. This is why people tend to pop out a lot with varicose veins when they're pregnant, but also elevated estrogen levels. Now let's talk about this, because I think a lot of times people, and a lot of doctors too, only think in terms of medicine, right? And I think that's such a disservice to the patient, because they don't live their life just based on so you say, okay, elevated estrogen. What's that? Birth control? Well, not all birth control is estrogen, but even the ones that are, what if somebody's like, yeah, well, I've never been on birth control before. Yeah, but let's take a look at a lot of things. These processed foods, foods at restaurants, foods at fast food, especially that damn Chick-fil-A. Y'all know how I feel. But anyway, processed foods. These foods are high in phytoestrogens. They cause, if you notice, have you guys noticed you're starting to see a lot of males with like man boobs? They be skinny dudes, but they got male titties. They got nipples. They got like mounds. That's not normal. It's like people think, oh, I only go to expensive restaurants. Y'all do realize that the Longhorns, the Red Lobsters, who are these other people? I don't know, Chili's, Applebee's, and Ruth's Chris, and Del Frisco's, and all these places. So from cheap to expensive, they all get their food from the same manufacturer. Now, how they prepare it, that's on them. But they all get their food from the same manufacturer, and it's processed. A lot of the different, like, a lot of people are like, oh, I go to Trader Joe's. Okay. Trader Joe's is actually one of the stores that was kind of like getting stuff from the whole Bill Gates-ish situation, whatever was going on, y'all, as far as whatever his company is. Trader, and this is public knowledge, like you can go online and find this information out. That was one of the places. If you ever look, there are so many recalls on the foods from Trader Joe's, like so many recalls. And I'm a Trader Joe lover. Like, I love the experience, but I'm real funny with what I buy from there. I don't get any of the bag stuff. I don't get any, like, the stuff in the bags. Like, I don't get any of that stuff. Sometimes, depending on the situation. Now I've been scared straight. I don't really even get the produce there. Like, I'll get vegetable wash and different things like that, but I'm real funny. It's a real cool experience. But if you look at the food, if you look at the labels on the food, how processed the food is, how many recalls they have, is it really worth it? So those are things that we have to be very, very mindful of. Like, cook your food. Cook your food. Even foods to be like, oh, I'm vegan, we only eat soy this and soy this. You do realize that soy not only is going to increase your weight, but it is also going to increase the amount of phytoestrogens in your body. Phytoestrogens increase not only weight, but your risk of developing certain cancers, especially GYN cancers and breast cancer. So be very careful. In a condition like this, I'm sorry, I do, in conditions, and you guys know me, any condition that doesn't have a straightforward medical reason, oh, well, this happened, oh, well, that happened, oh, well, this happened, I'm always a strong proponent of it was a dietary thing, likely, and lifestyle changes, and more non-conventional Eastern medication or Eastern treatments and herbs and things like that are going to fare better. And we'll get into that. So that is essentially the spiel and how we think it occurs, but we're not 100% certain. And my take on it is it's a high level of inflammation. High level of inflammation. Some people are more susceptible than others, but it is a high level of inflammation in your body, in your veins, in your pelvis, the whole 9 yards. And we'll talk about that. How to tell. How can you tell if you have pelvic congestion syndrome? You can't. It's imaging a lot of times. It's a collaborative. It's you being open with your doctor to say, hey, I'm experiencing a thing, right? And I don't know what this is about, but I know that it's not normal. I'm experiencing it, and it's for a provider to listen to you, to say, wait a minute, tell me again what is happening, and not brush off your concerns. That's the first thing, because so many of the symptoms look like so much other stuff, like I told you. And so the first thing is for a doctor to put their hands on you. This is why I don't understand y'all swabbing y'all own vaginas, y'all getting y'all own vaginal cultures, y'all damn near get these at-home pap smear. What y'all doing? Because you actually have to touch. I don't know what doctoring or medicine is these days, because you actually have to touch people. I'm sorry, I hate to break it to the new docs. Yeah, if you're a germaphobe or if you don't like to touch people, you've probably picked the wrong line of medicine, wrong field to, yeah, you just shouldn't be a doctor, period. Let me not say it. You just shouldn't be a doctor. Okay, you have to touch people. And so a sense of fullness. We start with the pelvic exam. Maybe you see some varicosities or some vessels inside the vagina, on the butt, on the thigh. Maybe when you do the exam, you feel a sense of fullness. There's something with the patient's symptoms that makes you say, let me get an ultrasound on you. And it may not be able to be seen by ultrasound, but a lot of times it's varicose veins in those places, but oftentimes you see nothing, okay? But again, when somebody has a complaint about this, investigate. Ultrasound is the first step. Do we see anything with ultrasound that would lead us to be like, oh, this looks so dilated, this looks a little this looks consistent with pelvic congestion syndrome? That was the ultrasound. A lot of times you'll have to go for MRI or CAT scan, but that I actually got that on ultrasound today with the patient. I was just like, wow, damn, like it must be pretty interesting or intense that an ultrasound was able to pick it up. But anyway, so you may see varicosities, you may not see varicosities. Oftentimes it can bother your bowels too. A lot of times patients are diagnosed with irritable bowel syndrome, but you'll have frequent bouts of diarrhea or constipation. Again, it can look like something else. Stress incontinence, and then we know when you laugh, when you cough, when you sneeze, that you can urinate on yourself a little bit. Now, let me put a little disclaimer on it, because I'm not shaming nobody, because nieces and aunties, y'all know I love y'all, but don't go up in them folk office, okay? Where because we know what make it happen too. You done had some childbirth situations, you got a little weight up on you. It's okay, a little midsection weight, it's okay. We don't judge over here, because your girl got a little midsection too. We're not judging, but don't go up in them folk office talking about I think I got pelvic congestion syndrome, I keep peeing on myself, and you on child number 6 and that little midsection is like, that ain't it, sis. Don't. Okay, so I'm saying some things can look like others, but hold on now. And also you can have pain when you pee. So again, what are we going to think about? Sometimes we think about stones. Sometimes we think about UTIs. We can think about interstitial cystitis. So a lot of things can one thing ain't necessarily going to be the do all end all be all. It is going to take a patient who's astute with their situation, a doctor who's willing to listen, and different testing. That's what it is. That's what it's going to take. And like I said, it's an ultrasound, an exam first, and then an ultrasound. If the ultrasound doesn't pick it up, it is MRI or CT. Now, there's something called a vein, what do they call it? A veinography or something like that. I can't really call the name of it, but nobody really does that because it's like super duper invasive. And it's like, going into the groin and doing this and baby, ain't nobody doing all that. But certainly, the MRI and the CT can get you where you need to go as far as diagnosis is concerned. Now, let me say this. When we talk about treatment, because I'll tell you what, you can't treat it. There's no cure for it. You can't treat it. You can treat the symptoms, but you can't treat it. And that's not necessarily wrong, but let me give y'all my take on it. My take on it is, first of all, a lot of it is going to be lifestyle. The first thing you want to do is change your diet. And I don't care if you got from endometriosis to PCOS, and y'all know that's my jam. Go back and look at the PCOS videos if it happens to be you, sis. But endometriosis, PCOS, and even conditions like this that are highly, highly inflammatory, you want to change your diet. An easy way of saying that is just say like the Mediterranean diet. Even my hidradenitis patients, Mediterranean diet, okay? And those are lean meats, those are no processed food, low carbs. And don't be confused, because people tend to think, oh, I'm eating healthy carbs. Carbs are carbs. Carbs are carbs. So you can do some fiber stuff, okay, great. But when it comes to fruit, my patients know it's only certain fruits you can have. Berries. Don't miss me with all the other fruit. Miss me with the honey. Miss me with, no. Okay, it is too. If you ain't sure what to do, get at your girl. I will make sure that, you know, especially if you have any of these conditions and you want to know and understand how to feed your body, but definitely low inflammatory diet, Mediterranean diet is a great thing. Also, make sure you're staying good with exercising. Don't do a lot of weightlifting. Do not do a lot of weightlifting. Yoga is good. Pilates is good. Light weights if you want. High intensity workouts are great. Cardio workouts are great, but not weight training, okay? Also, I am a huge fan of, a proponent of, and definitely make sure that I get acupuncture. Acupuncture and acupressure are amazing for conditions like this. Amazing for conditions like this. Now, and make sure you're hydrating well too, okay? So that's always a good thing. Make sure you're well hydrated. Make sure you're on a very, very, very low inflammatory diet. Very low, okay? And I usually say that's a lot of proteins and almost no carbs, like little to no. And if you do carbs, let the carbs be vegetables. Let the carbs be some meat, some beans. Not a lot of beans, but some beans. A lot of vegetables, and very, very, very minimal grains, okay? Good fats are okay, like your avocados and different things like that, but just be very mindful. Dairy tends to cause a lot of inflammation with people. It also causes a lot of mucus buildup, which is the start of disease. So be very careful with your dairy as well. Now, there are 4 herbs. I told y'all it was going to be a non-conventional treatment. But outside of your exercising, you're changing your diet, you're hydrating well, herbs. Now, I told y'all before, ginger and turmeric, baby, they might as well just put that in the water. Baby, ginger and turmeric, baby, is anti-inflammatory. And both of them improve your circulation as well, which is what we're looking to do. But we want to decrease that inflammation and improve that circulation. So that's going to be ginger and turmeric. Like, miss me with anything else. If you got any condition, baby, that treat everything from colds to cancer. I told you, I'm sitting on the back porch, y'all, so excuse the noise. That treats everything from colds to cancer. Like, y'all know how I feel about ginger and turmeric. Now, that ginger, I'm all for it. I can't take the taste of it personally. I can't, but I still take it sometimes because I have to. It's good for you. But whoo. But ginger and turmeric, if that's your jam and you with all that, that's what's up. Another herb is horse chestnut. I've never really heard of it. Did some research on it. I love it. It's that girl. Now, anytime I send y'all to go to do anything herbal, I'm like, go and see the herbalist. Don't be on the shelves like, oh, I'm gonna take 2 of these, maybe I'll take 3. No, go and talk to an herbalist. Any herbal store is going to have an herbalist there, or something resembling herbalist. You never know these days. But make sure you talk to the herbalist at the location to make sure if you're on any other types of medications that you're not going to have an issue, because turmeric, again, it kind of functions like a blood thinner because it has high anti-inflammatory things. So it kind of functions like a blood thinner. So you have to be very careful with some turmeric and some medications, some foods that you eat. So always make sure that you're talking to an herbalist. But horse chestnut honey, that is supposed to strengthen your veins and improve your circulation. So that's going to be one of the top ones for me. It's going to do it for me. And butcher's broom. Child, y'all ever heard of that? Me either. But, I had to read up on it and be like, so what is this butcher's broom all about that I'm about to be taking to my audience? Because I don't play by my nieces and my aunties. But it is supposed to help with circulation, and it's an anti-inflammatory. It helps with hemorrhoids, and it also helps with orthostatic hypotension, which, again, I told y'all that you can very much suffer if you do have pelvic congestion syndrome. So I hope that, and talking about this, because it just seems like, I don't know, I always know, like, if I see something in one place, it's confirmation, and if I see it in another place, that it's something that we need to shed light, understanding, and information on. And sometimes it's like, when you read stuff online, when you're a patient, you don't know necessarily what to read. That might be somebody's opinion. That might be a blog or whatever the case may be. It might not actually be sound medical information. So when I see something like that, I'm like, let me get on here and actually kind of explain what this is now. As far as, because I know this person had a concern about their fertility. So I actually delivered probably about two patients, and don't be like, well, that's all she delivered was two. Baby, the girl has had over 7,000 deliveries and no fatalities. Thank you. God is good all the time. JC. But anyway, so but I've had a couple of patients with pelvic congestion syndrome, and it's really interesting because it's like the vessels on the lips of their vagina, they like jump out. Like, you be scared. You be like, you open up, like when you put a speculum in the vagina, you so scared because you like, if I tear through one of these vessels, because it's so engorged. One, because they do have pelvic congestion syndrome, but because they're pregnant, and that makes it even worse. So in situations like that, I just went on and did a C-section on a patient. I'm not fitting to disrupt none of all of that over there. I'm not exactly sure why somebody would think that they couldn't carry. If there was a situation where it's really bad and they're prone to thrombosis, or what we call blood clots, then throughout the pregnancy, we would just put them on like a blood thinner. And then their delivery would be kind of a scheduled situation. So they would come in, we would stop the blood thinner 24 hours before, then we would start them on a medication that would thin their blood until they got through labor. And essentially, we would stop that medication 8 hours before delivery was scheduled, or before delivery was scheduled, or before it appeared as though they were going to deliver, and would be able to get control of the situation like that. So certainly you would have to be seen by a high-risk doctor, but just to manage the blood thinning situation with medications throughout the pregnancy, because when you're pregnant, that's a hypercoagulable state, meaning you're at increased risk for developing clots anyway during pregnancy. And then with pelvic congestion syndrome, we will go ahead and put you on a blood thinner. But people who have hypertension see high-risk doctors. People who have diabetes see high-risk doctors. People who are morbidly obese, they see high-risk doctors as well. So it's not anything rare to see a high-risk doctor. And yes, a skilled obstetrician could certainly get you through a pregnancy with pelvic congestion syndrome. Now, for any of my patients, and I start talking to my patients about it at like 23, because anything can happen. This can happen. Endometriosis with a frozen pelvis can happen. Any type of cancer can happen. Anything can happen at any time. So I start talking to my patients very, very early along about egg preservation or egg freezing, and you don't have to want to do it, but I'm always in a space of you don't have to want to do it, but I feel like your gynecologist or OBGYN has done you a disservice is the first time you're ever hearing about egg preservation as if when you need it. So I don't like that. Just like women are waiting to have babies longer, getting their education, getting their money right, getting their credit right, whatever it is you feel like you need to get right. So when they're 38, 39, 40, they're like, okay, ready to have this baby, which is not old. That's perfectly fine. Let me be clear. But then they find out they have fertility issues. Again, that's not a big deal, but oftentimes once you reach a certain age and you go to the fertility specialist, they no longer want to use your eggs because your risk of failure is higher. So now you're like, okay, I just learned I have a fertility issue. I prepared my whole life for this. Now you're telling me that I'm going to have to get donor eggs. It's a whole lot to process. So I start talking to my patients about egg preservation early on. And if you need them, great, you have them. If you don't, great, you still have them. So in a situation, especially pelvic congestion syndrome, where you're like, I can't take this anymore, and maybe you may want to have something done with your ovaries, or maybe you may just be like, forget it, and ultimately go for hysterectomy. At least we have eggs. You can have a surrogate, or whatever the case may be. Not to say that you can't carry. I'm just saying I just put all options out there so that we are in front of the situation and not chasing the situation. So I hope this helps somebody. I hope this has made people say, wait, I have a lot of those symptoms or all of those symptoms. Let me talk to my gynecologist. Let me see if I can get tested for this. Let me see if something comes up. And if you already have the condition and you know that you have the condition and you've been diagnosed, maybe this video has helped with some things, implement some things into your treatment or into your regimen that maybe you hadn't thought of, or maybe your doctor hadn't thought of. It's all just to help. So at the end of the day, I hope this did help somebody. Thank you so much for joining me, Dr. Tasha, for Monday Medical Moment. And please make sure you like, subscribe, and share this video with anybody who you think can benefit from it. Happy Monday, and I'll see y'all back on Thursday. Bye.